Think sports eye injuries are only caused by direct hits? Think again. There are hidden risks you might not see coming, and they could lead to serious traumatic eye injuries. Welcome to today's video. I'm Dr. Aisha Butt. Thanks for tuning into our channel. Join me as we uncover the surprising dangers that threaten your vision and discuss the crucial steps for eye injury prevention, like the importance of protective eyewear. So stick around to learn how you can safeguard your eyes on the field and avoid lasting damage. Did you know that 90% of sports-related eye injuries are preventable? Whether you're on the basketball court, the soccer field, or in a swimming pool, your eyes are constantly at risk. High-speed balls, player collisions, environmental debris, and even waterborne bacteria can lead to serious eye injuries. Some minor, but others life-altering. These injuries range from simple corneal scratches to retinal detachments and even traumatic brain injuries, also called TBIs for short. These can cause double vision and eye misalignment. The problem is, many athletes don't realize how vulnerable their vision is until it's too late. Today, we'll go over the most common sports-related eye injuries, how to prevent them, and what to do if you or someone you know suffers an eye emergency. One of the most serious risks in sports comes from direct impact, whether it's a basketball to the face, an elbow during a soccer game, or a fast-moving tennis ball. These hits can cause, number one, retinal detachment. If the retina pulls away from the back of the eye, vision loss can occur if not treated immediately. Number two, orbital fractures. A strong hit can break the bones around the eye, leading to swelling, double vision, or even muscle entrapment. Three, traumatic brain injuries and concussions. These can result in dizziness, headaches, and even double vision, difficulty focusing. Many people don't realize that head trauma often damages a specific eye muscle called the superior oblique muscle, leading to eye misalignment and difficulty with depth perception. Now mind you, don't forget the most basic things like corneal abrasions and foreign body. Now remember, even if you're not playing formal sports, scratches on the cornea are incredibly common in sports, whether from flying debris, fingernail scratches, or rubbing the eye after getting sand or dirt in it. Corneal abrasions can be extremely painful and, if untreated, can become infected. This is where emergency care can make a huge difference. But not all emergency rooms are equipped to handle eye injuries properly. Unlike ERs, eye doctors, both optometrists and ophthalmologists, have magnified slit lamps to thoroughly examine the cornea, and we have dilation drops to check for retinal detachments. In case of severe corneal damage, I use amniotic membranes for fast healing and minimal scarring, or bandage contact lenses to relieve pain and promote recovery. Now let's switch to water sports. Swimming pools, lakes, and even shared sports gear can expose the eyes to harmful bacteria. One of the most dangerous infections is acanthamoeba keratitis, a rare but aggressive infection that can lead to corneal ulcers and permanent vision loss. Contact lens wearers are especially vulnerable, making prescription swim goggles a must-have for eye protection in water sports. Now let's go back to concussions or traumatic head injuries. Many athletes don't realize that concussions can impact vision just as much as they affect the brain. After a head injury, it's common to experience double vision, eye misalignment, difficulty focusing and tracking moving objects, and sensitivity to light. This happens because head trauma can damage eye muscles, nerves, or the pathways that control pupil responses. In my clinic, I use visual field testing to assess peripheral vision loss and pupil testing to determine nerve function. Eye doctors, both ophthalmologists and optometrists, and some of the neurologists as well, use visual field testing to assess peripheral vision loss and pupil testing to determine nerve function. Only these kind of doctors can pinpoint damage to specific areas like the superior oblique muscle, helping us guide treatment properly. So why emergency rooms aren't enough for eye injuries? If you suffer an eye injury, your first instinct may be to go to the ER. However, most ERs don't have the specialized equipment needed to properly diagnose eye injuries. They lack the slit lamp for magnified corneal exams, They don't have dilation drops to assess retinal detachment. They don't have the specialized eye imaging tools for nerve and muscle injuries. As an optometrist, I work closely with retina specialists and surgeons to ensure immediate care when needed. I even keep direct phone numbers for local retina specialists so I can detect a retinal detachment and I can arrange a same-day surgery to prevent permanent vision loss. The good news is that most of these injuries can be prevented with the right precautions. Number 1, wear protective sports eyewear. Polycarbonate lenses in a sports eyewear frame are 10 times stronger than regular glasses and can withstand high-impact collisions. Number 2, use helmets and face shields, especially in sports like hockey, football, and baseball. Number 3, take care of your contact lenses. Improper hygiene can lead to dangerous infections, especially for athletes. Number 4, for swimmers, use prescription swim goggles to protect against bacteria and chlorine irritation. If you're using daily disposables for you to swim in, make sure you take them off as soon as you're done swimming. So let's talk about what to do in cases of an eye injury. Number 1, blunt trauma. If you experience pain, vision loss, or flashes of light, seek emergency eye care immediately because it could be a retinal detachment. Number 2, scratched cornea or foreign body. Do not rub the eyes. Visit an optometrist for a thorough exam. Get the photos of the cornea to make sure that we know what we're talking about. Concussion-related vision issues, if you have double vision, dizziness, or headaches, schedule a post-TBI vision assessment as soon as possible. So what are some of the steps we take, or how do eye doctors help post-injury recovery? If an injury does happen, modern technology and testing allows us to help athletes recover faster and more effectively. Vision therapy and temporary prisms can help realign eyeballs and reduce double vision after a concussion. Visual field testing identifies extent of vision loss and tracks recovery in TBI patients. Specialized pupil testing helps isolate nerve damage, which can affect how the eyes focus and track movements. Eye injuries in sports are more common than you think, but they don't have to lead to permanent vision loss. With the right preventative measures and immediate care from an eye doctor, you can protect your vision for years to come. If you or a loved one experiences an eye injury, don't rely solely on emergency room. Visit a specialist who can properly diagnose and treat the issue. At TSO, we offer emergency eye care, advanced diagnostics, and customized treatment plans to help athletes recover quickly and safely. Stay safe, protect your vision, and keep performing at your best. If you found this information helpful, make sure to hit that like button and subscribe for more tips on eye health and injury prevention. And don't forget to leave a comment below. Have you ever experienced an eye injury while playing sports? Share your story, please. Stay safe, protect your vision, and see you in the next video.